So I first want to thank the mom for posting this video. I think it can be really helpful for parents to share their experiences in the intensive care unit. So the oscillator, what she's showing here, it is a big, loud, and scary machine. Why would you use it? Well, normally when we put a breathing tube in for a patient and use the ventilator, we inflate the lungs the way that people normally breathe when they don't have a breathing tube in. So we take breaths a couple times a minute. And for babies, they breathe pretty fast. So we'll give breaths, 20, 30 or more times per minute. But when the lungs are sick for whatever reason, so in the neonatal intensive care unit, it's usually because babies are born premature and they didn't have enough of something called surfactant on their lungs. So they haven't fully developed and it makes the lungs very stiff. You can imagine that if the lungs are really stiff, we have to use more pressure to get air in and out to breathe for the babies. This pressure can actually damage the lungs. This is called barotrauma. When the lungs are very sick and those pressures are very high, we often think about switching to a different type of ventilator. And in this case, you call it a non-conventional ventilator. So the way the oscillator works is you basically inflate the lungs, and rather than doing breaths a couple times a minute, it is essentially taking tiny amounts of air in and out with a piston and using that to get oxygen in and carbon dioxide out. This is not the way the babies are used to breathing, so it can be uncomfortable and often requires more sedation and sometimes even paralysis or medicine that relaxes your muscles so you can tolerate it.